The government of Guyana has secured a US $97 million loan from the Inter-American Development Bank (IDB) to finance the construction of the state-of-the-art hospital in far-flung communities across the country. At Kamarang, Upper Mazaruni, Region 7, Cuyuni-Mazaruni, a new hospital where surgical procedures can be performed was established. This is part of efforts to elevate healthcare here and ensure that residents in remote areas have access to testing, x-rays, CT scans, ultrasound, and diagnostics services without leaving the region. Residents living in and around the village welcome the facility and the greater good it brings.
Has always been a big dream for us in the Upper Mazaruni, waiting for such programs, services to reach into our areas. And I think this is a big move for us and something that we are going to welcome wholeheartedly.
Yes, we have been crying for this institution, I should say, this health sector. And when these services come to our district, like I said, I was very much happy, and it's really helping a lot of people in this district. And this is the first experience or the history of the services what came up to the Upper Mazaruni.
Tamika Bihari, a resident of Kamarang for 10 years, believes that the new hospital will not only transform healthcare, but also create job opportunities in the health sector for hundreds of young people in the region. She said the indigenous peoples living there are very traditional and prefer to be closer to home when undergoing procedures. This facility fulfills that need.
Well, I'm very proud because, as we know, this area is traditionally Amerindians, and persons being here in their home actually able to access surgeries, it's more comfortable for them because they can have that support of their family instead of going to town and being there with just one family member. You could have your extended family here with you.
The doctor in charge at the district hospital, Dr. Mark Allen, said rapid development in the isolated area has over the years made healthcare more accessible. It is also the telemedicine hub for the region.
When I first arrived here, the infrastructure was poor. We had little to no resources. Over the years, we had worked to have a proper supply chain in relation to medications. Now we have a proper supply chain from MMU to Kamarang, and Kamarang generally supplies most of the health posts. Now we have access to a better laboratory services. We can offer full CBC services, full biochemistry services. The average patient who would have to travel to Georgetown or to a private institution to get these things done can now have them done right here.
Meanwhile, Dr. Vishwa Mahadio, the Director General of the Ministry of Health, provided an update on the project, confirming the identification of the hospital's construction site and outlining the next steps in planning and design. He assured the services will remain available to patients during construction. Reporting for the newsroom, Lazina Yearwood.